Hi everyone, once again I'm Osakit and welcome to my YouTube channel. So today basically we're talking about something that affects about 17,000 people every year, either due to traumatic experience or non-traumatic experience, which is popularly known as SCI, spinal cord injury. What is spinal cord injury? Okay, before I get into the main definition of spinal cord injury, I would like to take a brief history on the anatomy of the spinal cord. So we all know, all major or minor, are aware that the spinal cord is a part of CNS, which is basically responsible for the transmission of motor and sensory information in the body, right? So imagine when there's a lesion to this anatomical structure, it brings about what we call spinal cord injury. Now, if there's a lesion to this anatomical structure, there's either a shutdown at the sensory receptor or at the motor receptor, which brings about spinal cord injury. And this spinal cord injury, they are classified based on causes and type. You get? So under the causes of spinal cord injury, there is traumatic and there is non-traumatic. So when you talk about traumatic, you'll be considering cases of fall, RTA, that's road traffic accidents, sports injury. Sports injury. Most of these athletes, they come down with spinal cord injury most of the times. Maybe they fall on the court and all that. Then they fall in the field or in the court and all that. Then we talk about the non-traumatic. So now when you're talking about non-traumatic cases of spinal cord injury, this can be as a result of tumor, can be as a result of no tumor, which is basically cancer, or an overgrowth. So that is still cancer. That's basically what brings about the non-traumatic. So there was no accidental occurrence and all that. So and then we have the types of spinal cord injury. It can either be a complete spinal cord injury or an incomplete spinal cord injury. So when we say a complete spinal cord injury, we're basically talking about we are considering the section that was affected, if it was the sensory and the motor. So in a complete, both the sensory and the motor receptors are affected, while in an incomplete is either the sensory is affected and the motor is spared, or the motor is affected and the sensory is spared. So that's basically that about spinal cord injury. So now, why a physiotherapist is trying to assess you or to classify if this is a complete and incomplete spinal cord injury, they basically use the Asia scale. As a physiotherapist, there are 6 stages for management of an SCI patient, and these stages I will be listing them. There is basically going to be your first stage, which is your initial assessment and goal setting stage. Your second stage, which is your acute stage. Your third stage, which is your subacute stage. Your fourth stage, which is your advanced and community stage, and your fifth stage, which is your spasticity and pain management stage, and your sixth and your last stage, which is basically your educational and psychosocial stage. Stage 1, in the stage 1, which is your initial assessment and goal setting. Here basically the physiotherapy will be focusing on some certain things. But first of all, they are going to be assessing for the segment affected in the spinal cord, if it was the cervical region, the thoracic region, your lumbar region, or the sacral region that was affected. And then again, it's also going to be checking for the type of spinal cord injury using the Asia scale to know if it's complete or incomplete, like I mentioned earlier. And also be conducting some minor assessments like the MMT, which is the manual muscle testing, using the modified Ashlock scale to check for spasticity. The physiotherapist is also going to conduct a sensation test, as well as range of motion to check the capacity of this patient and know what the physiotherapist is going to do for this patient in order to help this patient advance to the next stage. So that's basically what this initial assessment stage and goal setting stage is all about. It's all about assessing your patient and knowing, this is where this patient is and this is where I want this patient to be in the next segment. Second stage, in the acute phase or acute stage, the physiotherapy is going to be focusing on some certain elements, starting from the position of this patient in order to prevent pressure sore, to the range of motion in order to prevent contraction or immobility of the joints. Okay, then the third, the patient will do the physiotherapy will be focusing on respiratory care. The physiotherapy will advise this patient or administer to this patient to conduct to do some BBE or HCT in order to prevent pneumonia. Third stage of recovery, which is the subacute phase. This phase is very vital and important to both the patient and the physiotherapist because this stage will determine the level, the transmission of this patient from a dependency level to a partial or semi-independent level. So here basically the physiotherapist is going to be focusing on muscle training, either above or below the affected area in order to encourage healing. Okay, and also the physiotherapy is going to be educating the patient on basic transfers like lying to sitting, sitting to standing, transferring to the wheelchair, and then thirdly, the physiotherapy is going to be conducting some balance and core tests in order to initiate and encourage balance and core strengthening. Third stage of recovering, which is the advanced and community stage or phase. So in this stage, the physiotherapy is going to be incorporating mechanical and then modalities into treatment. Modality like FEC, that is functional electrical stimulator, in order to stimulate the nerves innervating the muscles that are affected during the spinal cord injury. Okay, as well as the physiotherapy is going to introduce the use of exoskeletons in order to help in the mobility of this patient. Also, there are other modalities that the physiotherapy can implement, like the use of hydrotherapy. And hydrotherapy now helps in encouragement of buoyancy. And when you put a patient in hydrotherapy, there is encouragement of buoyancy. And buoyancy is basically making this patient's movement, easing the movement in water, because the water has the property of being buoyant. So it elicits an effect on this patient's body part, making the body part less weight and more denser than water and allowing it to float above the water. So onto the fifth stage, which is the spasticity and pain management stage. In this stage, the physiotherapy is going to be conducting some stretching and positioning, as well as collaborating with the medical teams for the administration of drugs like baclofen pump and oral spasmodic tablets. Okay, so this baclofen pump now is basically it's a muscle relaxant that acts by mimicking the function of GABA. And we know GABA is a chemical substance that is contained in the spinal cord and the brain that helps basically in the inhibition of nerve signals in the body. So baclofen acts centrally, the muscle relaxant, and it is needed for what? For prevention of pain and inhibiting nerve conduction signaling. So hereby shutting down the transmission of pain signals to this patient's body system. Okay, then moving on to antispasmodic oral. So here the oral antispasmodic is basically the position of spasticity. So it's going to help reduce spasticity on this patient. So that's what this stage is all about. The last stage of recovering, which is basically the educational and psychosocial support stage. So in this stage, you're educating the patient of what to do and what not to do in order to agitate, and what to do in order to help elicit the pain and help resolve the situation at hand. So then psychosocial, here you're going to encourage this patient and tell this patient that spinal cord is not the end of it. It's not the end of it. It's not the end, and you can fight through this. So that's basically what the stage is all about. Okay, then that's it for this video, guys. Thank you for staying tuned into my YouTube channel. I'm hoping to see you in my next YouTube video. Subscribe to my YouTube channel, hit the notification bell, and don't forget to like. Okay, so in my next video I'll basically be talking about the myths that sees the reality of this profession being physiotherapy, why you should search more and why you should stop focusing on popular opinion and all that, and why you should research and stay focused in your goal, baby girl or baby boy. So that's basically what my next video is going to be. And it was really a tough notch making this video, so it was really a stressful one, but yeah, I guess we are done with this video. See you in my next video. Don't forget to hit the notification bell, subscribe to my YouTube channel, and please hit a thumbs up. And any question you have, you can drop on the comment section, and I will be really ready and happy to respond to your questions. Thank you very much for staying tuned to this video. Remain blessed. Bye bye.